building new social housing. We need more housing. We also need more money for homelessness programs and programs that help people who are homeless.
The importance of today?
Well, as you can hear, everybody here shouting, housing is a right. It's a right for all humans, and it's a shame that Canada doesn't have a housing strategy. It's one of the few G8 countries that has a housing strategy. The housing wait list is estimated to be approximately over 10 years, with over 90,000 households on a wait list. From my personal experience, my professional experience, I've had a client who's been staying in an acute care bed because simply there's no housing out there, any adequate housing for him to recover at home and in the community where he can thrive. So imagine how many healthcare dollars are being spent just keeping him hospitalized when he doesn't need acute care. What he needs is supportive housing, and he can't get that. He's been in the hospital for 6 months, and imagine what that can do to somebody's mental health.
Now, you work at Street Health. Have you seen an increase in homelessness?
Yes, I definitely would say that. I'm seeing more people on the streets, or more people who are asking me for to help them find a shelter bed. And the truth is, whenever I call central intake, first of all, they don't even want to talk to me. They won't talk to me. They won't let me advocate for clients. Instead, they want to talk to the clients who've already been experiencing long wait lines, having to use telephones, just waiting in line to use a telephone at Street Health is stressful. And when we finally do get through to somebody at central intake, the answer is always no, there's no bed available, call back in a couple of hours. Or they send people to Peter Street. And I've had clients who I've had to send to Peter Street, and they're also rejected a place for them to stay there because Peter Street is packed. So it is very evident that homelessness is increasing. It exists out there, and we shouldn't have to put our community members on the streets to die. What happened to dignity? What happened to respect? What happened to building communities, stronger communities? And being able to provide healthcare is a challenge for me if my clients don't have the simplest thing of having a place to sleep at night, having a safe space to go to at night. How can I even begin to talk about chronic disease management? How can I talk about healthy eating, healthy nutrition? How can I talk about ways to reduce stress when my clients are facing chronic homelessness or chronic stress?
Thank you, sir.
Okay, thanks.
National Housing Day. We're in the heart of the city of Toronto, which is also the heart of the national disaster of the housing crisis. And we're here and we're calling for the federal government to bring back a national housing strategy.
Thank you.